Oakville Trafalgar Memorial Hospital is now home to Halton Healthcare's brand new lung diagnostic clinic.
Up until now, if people had a lung nodule or otherwise described as a spot that was seen on their lung images, whether it's a chest x-ray or a CAT scan of some sort, sometimes that could have been through the emergency department or the family doctor or other specialists, you would go through this process where you're not really sure, what is this? You're suspicious for some sort of lung cancer of some sort, and what can we do about it? And so the process would be long, kind of very fragmented, where you would have some sort of images done. You would see either your family doctor who would order some other testing, and then at some point you might get referred to a specialist, or you would go to a lung diagnostic assessment program, which there was nothing available locally, and you'd have to travel outside of the Halton region in order to gain access to one of these programs, where then they can expedite all of these tests for you and do it in a streamlined approach and in an efficient manner so that it meets Cancer Care Ontario guidelines.
According to Halton Healthcare, this new local clinic has patients scheduled within 2 weeks of referral and all necessary tests completed within 28 days to help facilitate early detection and effective treatment.
It makes a significant difference. We've had, unfortunately, some cases where, especially with the backlog the system is facing, of months before they can get tests done. And sometimes if you were getting one test in one city, they would have to travel sometimes an hour or so to get to that place to get the testing done. And they wouldn't have anyone that's kind of like their quarterback or a central hub that they can go to. So now this is all available for them here in the Halton region, so that all the patients that live in the area can actually access this care quickly and in an efficient manner locally for them, so they don't have to go very far to get this stuff done, and it can all be done within, once they're seen, we try to stick our best to the Cancer Care Ontario guidelines of 28 days to get all of the tests done of multiple different types of biopsies that are sometimes required, MRIs of the head, for example, breathing tests, all done within the 28 days of receiving the referral.
The clinic also boasts some of the most advanced diagnostic tools available, with only a few other hospitals in our province offering similar endoscopic procedures.
Part of the biopsies we can do are, one is we're using a special scope called an endobronchial ultrasound scope, where we can actually go in, take a look in the airways of the patient's lungs. We can actually biopsy then lymph nodes, which is like your body's sewage system that can sometimes be involved with cancers, as well as sometimes the actual masses itself. We also have something called a radial probe endobronchial ultrasound, which is a 360 degree view of an ultrasound that we can actually use to also biopsy some of those spots that may have been seen on CT images.
Another advantage of this program is a dedicated patient navigator to personally assist each patient through the entire process and help address their educational, emotional, and physical needs. For Halton News, I'm Jessica Kaitting.